was going to have to be today. After the meeting yesterday, our president spoke last night, and from that, there's been multiple fallout all over the place. Now, I'm going to read to you just a little bit. I don't normally do this, but on March the 4th, I issued a state of preparedness. It puts all our Division of Homeland Security, Emergency Management, and the National Guard and DHS at this time, like I said, there's no confirmed cases within our state. However, the situation was what our president said last night, and all that is happening, it's got to come here at some point in time. Now, the reason I'm away from the reading. I've got to just tell you what's in my heart. And there's all there is to it. Our elderly could be the most susceptible by far. People that are in to just go and be in big gatherings. They need to watch their health and everything that they're exposed to in every way. Above 80 is really dangerous. This virus, Bill Crouch would tell you, this viruses always attack somebody, whether it maybe be our children or maybe it be those that are pregnant or maybe it be the elderly, and this virus is targeting the elderly. That's a real problem because we know with this virus that kids can have it and not even know it. And as they don't know it, then they spread it. And that's what's happening all across our country. That's what's happening all across the world. So, now we'll try to read. Today, I'm issuing a state employee travel ban on both out-of-state and international travels for our state businesses. I am asking all West Virginians to reconsider all non-essential travel out of this state. I am also directing all of our state government offices to avoid holding any large meetings or gatherings. I am directing State Purchasing Director Mike Sheets to authorize all emergency exemptions so that agencies can acquire any supplies they may need as part of the response to this virus to protect the health and safety and welfare of the citizens of West Virginia. I am recommending that all West Virginians who are at the highest risk, just what I just said, of having complications from this virus, including our seniors and those with chronic health problems like heart disease, diabetes, and lung disease, these people should absolutely avoid any contact with large crowds, especially in places that don't have good ventilation. I am asking all of our nursing homes right now to restrict visitors with exceptions for those that are a life-ending or very, very, very serious illness. That's super hard with me. And the reason it's super hard is just this. If my mom were in one of those nursing homes and I needed to go see her, she really, really depended on me coming to see her every day. And then all of a sudden I can't go, or not a matter that I can't go, but there's a matter that, that just, it's in her best interest not to go, and she may not understand that. That really becomes problematic. So, and the last thing is just this. All of us know how important and how big the state basketball tournament is for all of us. We all know that. And I'm I'm due to coach a game at 7:15 tonight, and my team may very well be one of the favorites to win the state championship, and those kids have worked really hard all year long. I surely know what our state basketball tournament means to us. But Bernie Dolan is right there in the back, and I've met with Bernie, and I'm instructing Bernie that at the end of the session we're playing right now, shut it down. Now, we're suspending that, and we're going to try to work on a way that may very well follow suit with maybe some of the other states. We may have to play at a different location or whatever, but Bernie's a good man, and he's running a great ship, and he's going to figure this out. We may be in a situation to where we can play with a limited number of fans and limit those number of fans like some states are doing, but at the same time, let me tell you just this. It's my job to protect us, to protect all of us, and that's what I'm going to do. You know, I hate it terrible bad, because it's important to the state of West Virginia, it's important to this great city of Charleston, it's important to all those kids. But in all honesty, we've got to protect our people first and foremost. So, with that, I would tell you that we should still continue to live our lives as best we can, but we need to be smart. We need to really be smart. With the fact that every single body, whether it be the NCAA or it be the Big 12 or all of our conferences or be our state universities, are shutting down those events, we surely have to follow suit and do exactly the right thing. It's hurtful. It's hurtful. But this morning, following the president's, address last night, when it came ripping across, everybody is following suit. That's what we have to do. Even though in this great state we don't have a single case. But that's not going to be the way it is. Now, let's just think, and then I'm going to turn it over to these guys and to you, and I'll be right here too. But let's just think just this. We don't have any cases. We were really, really hopeful that by now this thing would be going away. But it continues to grow outside of our borders, and this monster still grows. And as it still grows outside of our borders, now we have to be prepared, because we are prepared, and now we've got to be proactive and even react even more. Now just think, here's the danger. Here's always the danger. All of a sudden it grows to an epidemic standpoint, and we are flooded at our community hospitals and everything, and then it becomes a real live problem. Pray tell, let's hope and pray in every way that this does not come within our borders in any way, shape, form, or fashion. And all we are doing is acting proactively in a way to protect our people. Nevertheless, that's the right thing to do. So we'll turn it over to you, and these great people can answer any question that I can't answer. If anybody's got...
How many people in our hospital system could we handle as we sit here today? What would be the number of critical care patients from this outbreak that we can handle with the existing number of beds in hospitals where we're set up?
I don't think there's a magic number with that. Hospitals have been preparing for a medical surge for several years. They work on that. They are strengthening their plans now, but it could be a challenge. And so that's why the importance of a proactive approach, because as much as we can not have a sudden increase and have to overwhelm systems, as much as we can do all these good proactive measures, as the governor said, we can slow it down in terms of the curve, and as we talked about yesterday, spread it out over time so it's more manageable.
If they were more aggressive about the testing tested on lesser symptoms, would that allow you to detect victims earlier and maybe not expose some people to that, or is that a fallacy?
Yeah, this is not about testing. This is about all of us at this point really just taking the measures that we can do to reduce our own risk, to protect our families, and to protect especially our elderly. So it really is about how we work together as communities to get the job done.
Governor, this may not need to be asked, but I'm assuming that the boys tournament is also off the table next week. Is that correct?
It is, yes, sir. Yes, sir.
Governor, just for clarity on the girls' tournament, you said it would be shut down after the current session. You're talking about the games being played right now?
Right now. And I think that Bernie would tell you the games that we're playing right now, as soon as this game's over, we're done. Is that correct?
There's a game that started at right around 1:15. As soon as that game is over, the tournament will be suspended.
And was there any thought, I mean, conferences are pulling teams off the court at halftime. That's the
Right.
thing. Is there any thought to saying, okay, this is enough, let's just shut it down? I mean, what is the purpose to continue playing this thing if we shut
Well,
down?
I don't know how close we are to finishing that game or whatever, but what the point would be just this, and I would be for stopping right this second, and I'm following Bernie's lead, because we just decided 5 seconds ago that we're going to shut it down and shut it down now, and it was Bernie's recommendation to finish the game that they're in, and I don't know where they are in that game. If they just started the game, we can stop it now.
Well, and the other reality is, this is not suddenly, it changes instantaneously, the risk. Those are folks that are together, they've been there, this is all gradual. So, I mean, it's not an unfeasible recommendation. We'll follow Bernie's lead with that, in terms of continuing the game and finishing it up and then moving on.
Yesterday, after our presser, the coronavirus website said there were 11 cases of testing, and then it went back down to 8. What happened?
Well, the 11 was more some of the additional ones that were en route, but not in the lab yet. So we have increasingly been getting more and more test requests and making those processed. So they are coming more regularly, higher frequency. We've again not had any positive, but we'd expect to continue to have more testing and have that done.
How long are we expecting the state travel ban to last? Is there any way to put a number on that at all, or?
Now, that's on a state travel ban for state employees,
Right.
Go ahead.
No,
I think a lot of these things we're looking at as being 3 or 4 weeks and then reevaluate, look and see where we are. Again, we're one of 3 states that have no cases at this point, so we don't expect that to continue. We think we will have cases. So it depends on how things are moving forward. What these decisions, which are very difficult decisions for the governor, I can tell you that, but he has said multiple times, we have to protect our citizens. So these are just ways to reduce the risk for the population in the state, and the population most at risk again is our elderly population. So we need to do what we can to protect ourselves and our family, and it goes back to the basic issues that we've talked about over and over, which is hand washing, not transferring the virus to your mouth, to your face. It's very difficult to break those habits. I'm having trouble breaking those habits, but that's what we need to do to really protect ourselves and our families.
I think
Not to belabor the point, but if you need to clarify for me, major sports leagues across this country have literally shut down at a second's notice and said, get out of the arena. Now, I'm not saying it's a code red and the place was on fire, but there's a sense of urgency coming from somewhere that's led by medical professionals. Why would we not act the same way?
So let's look at this. The risk today in West Virginia is not dramatically different than the risk yesterday, okay? With all of these interventions, we know they make a difference if you do them early rather than later. So we know they're disruptive. They are awful. We hate to have to make these decisions. The challenge is if you wait too long to make them, if we wait a week or 2 weeks, we have less effect. Then we have the disruptions, but not the benefit. If we could do them early, then we maximize the benefit, and so it's a better balance. So again, these are kind of continuums of things, and we're just saying it is time to start doing this direction, and the governor's been very proactive in terms of how to make that implement now. So.
How do you mitigate potential economic impact from these announcements on the state?
That's really and truly it's really simple for me, from the standpoint of the economic impact is enormous. We see what's happening with the stock market right now. We see our government infuse $1 trillion+ and really buys 400 points on the stock market, I mean, my God, Olivia, are you kidding me? The economic impact is off the chart, and we absolutely hate it. But what's the price on somebody's illness or somebody's life? I mean, really, when it really boils right down to it, you have no choice. You've got to move the economic impact to the side and look out for the people first and foremost.
Is there anything that the state can do, though, to sort of stem the potential consequences of the announcements that have had to be made thus far?
Well, sure. I mean, there's all kinds of things we can do, from the standpoint of, we can even grow our own economy with people, benefiting from our state parks and the fact that we're diverse and all that kind of stuff. And we just have got to get away from the big crowds. And Kenny, let me go back to your question, just this. And I really don't know where we are in the game, but I would be an absolute proponent if Bernie would be okay to shut down. I mean, but at the same time, you've got to remember, and this is Bernie and Clayton and, our great health people and all that kind of stuff, those people are already in the arena too. And once they're already there and gathered together and all that and everything, the risk of staying there for another 20 minutes versus just boom and doing something that could scare people totally to death, it may be more beneficial to finish the game. But
do we have a tests per day capacity in West Virginia? Do we know how many tests per day we can are capable of doing? Or
we are doing as many as we can, and we will ramp that up to the extent we can. I think the importance of commercial testing, we hope that will increase significantly in the near future. And so that's going to be really important and critical. I think, testing-wise, we all wish we had more ability to do testing across the nation. So it is just a challenge.
Governor, let's talk about some events coming forward beyond the basketball tournament. I believe next week the State Contractors Association is scheduled to have its big expo at the Convention Center. Our association, the West Virginia Broadcasters Association, is having its annual meeting in a few weeks. I mean, are you going to be asking some of these groups to shut down their events too, or is that to be announced?
I've just read it. I'm going to ask each and every one of them to reevaluate in every way and highly discourage a great big gathering of people at this point in time on the advice of our medical people. I keep going back to just that. Now, I'm not a medical guy, and I am telling our people, be smart, don't be afraid, but at the same time, I have to defer to the medical community to tell me what to do in regard to that.
Dr. Slump, you mentioned that we don't want to see a spike in the burden on hospitals, but we have actually seen a increase in closures of hospitals or announcements of closures. How do those closures impact West Virginia's ability to respond to the potential of the pandemic?
Sure. The healthcare system operates every day in ways that they're trying to wrestle just in time. They do this planning. They work on that. We want to make sure we protect them as best we can and sustain our employees there. It could be challenging. I mean, we're seeing in other countries that it's challenging in healthcare systems. So that's why we want to take these proactive measures to, as much as possible, really reduce that burden.
Now, when is it time to shut down public schools in West Virginia?
Well, let me tell you, I have some notes here that I was given me from the health people and everything. And maybe that's a better question for them, but I would tell you that their recommendation is maybe a suspension of extracurricular activities at this point in time. Mm-hmm. Their recommendations are students at increased risk of severe illness should consider implementing individual plans for distant learning, e-learning, but I'll let them answer that. I need to talk to Bernie. Where are we?
Yeah, those are the kinds of measures we're talking to Superintendent Birch about. and also things like strengthening social distancing measures in schools, so limiting that inter-school interactions, thinking about things like altering schedules so they stagger recess, looking at things like not doing large pep rallies, assemblies. I think, all of these are things, and the principle here is, and the governor said it as well, we need to live our lives. We're just trying to do it in smarter ways for this time period. So it's that concept of doing the things that we need to keep doing, but thinking about how we do them without having large groupings of people or really close contact. But we've got to stay connected to each other. We've got to do the things that we need to do, and there's lots that we can do with that. And so that's really important that we figure out how to do things in smarter ways right now as we go forward.
Some students live with their grandparents, and that's what a lot of concerns are, at least from our viewers, grandparents and adults are in the school. Doesn't that make you guys a little concerned? Because you even just said that kids can have the virus and spread it without even help.
And again, this is where you are always weighing these risks and benefits at every time. They're not easy decisions. You wrestle with them. You see where things are, and you make them as you go. So I think we have to just take that a step at a time. There are big issues with closing schools in our state.
I'm not a medical professional, but schools, at least in my memory, are petri dishes of every type of cold, runny nose. It almost flies against logic if you're shutting down a basketball tournament and WVU and Marshall are closing. When you have 30 kids in a classroom or 300 kids in a cafeteria, are we in or are we out here? What are we doing?
I think we need to work collectively together to do the most important things at the right time. And so I think we look
Kenny,
at
I know how you think, and you know how I think and everything. And I would say just this. We've got to still stay connected, but at the same time, this is very fluid. This changed in the last 24 hours in a big way. Really and truly, if it changes again in the next 24 hours in a big way, we're probably looking at shutting the schools down, But right now, the health officials say that's not necessary to do. And we've got, and whether you agree or I agree, we've got to go with them right now. They know what to do, and let's hope and pray that we make the right calls.
So as of right now, kids will return to school on Monday. Those who are on spring break and will come back like nothing. Okay.
But
And the
schools are
difference
making-
between the college-age kids and spring break is they go all over the place for spring break, and then they come back. Our school-age children are a little different in terms of their ability to be in those environments that might bring the virus back to West Virginia. So that was one of the reasons for that. It was very proactive, and I thought it was very, very smart on behalf of the schools to do that.
Wait a minute, hold up, everybody. I don't want Bernie to have to stand here forever. He just said, well, you tell.
We're late in the third quarter. We were before I walked up here. So at that point, it doesn't make sense. The people have been there for a couple hours already because there's 3 sessions in a game. The next 20 minutes is not going to be crucial, but moving forward, not bringing new people into the facility this afternoon or this evening certainly makes sense not to do it. So we think it's prudent to go ahead and finish this last little bit of the game and then just suspend from that point.
Again, the risk today is not dramatically different than the risk yesterday. But we just wanted to be proactive and start to put these measures in place so that we can prevent further challenges down the road.
Governor, give us a sense of how often this working group is meeting and talking during the day. Do you conference call every 2 or 3 hours?
We're talking nonstop. We're talking nonstop. And we've been talking nonstop. These people are working 24/7. This isn't something you just work a little bit at. Everybody is on top of this in every way, and that's why we're doing what we're doing right now too.
It seems like the case is inevitable. Are there plans at the state level if food pantries have to close to give food to people who need it?
Well, those are some of the things I think that are really helpful at community levels, to be thinking about how do we sustain services in safe and effective ways to folks. So, there are ways that you can, I helped manage a food pantry at one point. There are ways that you can distribute food without having people come in really close contact with each other. Lots of ways to do that. So it's thinking about not stopping everything, it's thinking about how do we do them in smarter ways that increase the distance between people. And so that's the creativity we need to put to it.
Is there an actual support system at the state level to help communities implement programs?
There's a support system, trust me.
Can you detail that?
Absolutely. There's multiple support systems right here. I mean, if we get in a situation where we've got to shut the food pantries down, our guard will step in and do whatever needs to be done.
I think
We're going through planning with DHHR and other agencies right now to provide the logistical support that might be needed. While it's somewhat different, but it's not a lot different than what we dealt with several years ago with the water contamination. We had to step in and provide supplies and logistic support and capability. Going back to the schools piece, we provided extra surveillance within, but did not shut down. In some cases, we did have to shut some down while we did some additional surveillance to make sure it was safe for students. So we have Guard Planner embedded in DHHR Threat Preparedness Office right now. We're going through our normal military planning process churn to be prepared for events that come up, and the governor's directed us to put the full weight of what we do in the planning process behind getting that ready, as well as providing training support to hospitals for donning and doffing PPE, the whole spectrum of things that we would have done in any type of emergency response.
I think it's important, one last thing with that, I think it's really important to remember, again, we're just talking about social distancing, getting people at 6 feet apart or so and not congregating in large crowds. I believe in the creativity of West Virginians. So there's lots of ways that you can get people food without having people right next to each other. There's lots of ways you can get together and go out and do things. You can go hike, and you can go take a walk, and you can still walk your dog, and you can have a phone call, and you can have conference calls. And so we are creative people. And so this is just a matter of putting that creativity to work to help manage a challenging situation.
Can you tell me what a large crowd is, how many people you would think that is? Because I think other states have been around too long.
Yeah, there's no magic number with these things. I think when you're getting into that, hundreds area, you're getting big. I think you can also, underneath that, think about how you do group gatherings smaller than that to really, in smarter ways. How do you spread people out a little bit? How do you put people in smaller groupings? So, again, this is about being creative and doing things in different ways.
If you have a situation where you have a large number of patients, how do you protect your medical professionals from contracting the disease and then not being able to take care of all these patients?
Yeah.
I think that's comparing fear.
This is really important that we support our healthcare workers, and so there's a lot of work, and I think that's part of all of us playing our role, so that we can help decrease that burden on our healthcare facilities, and so that we can allow them to do the job they need to do. And so, there is infection control guidelines out to facilities, as well as other supports to them. We look at equipment and supplies that we can support them with, close contact with the federal government around those issues. So those are the things that we think about and look at with that.
I understand we're not at this point yet, but is there a system in place if people do eventually have to miss work on self-quarantine or quarantine to help with utility payments, ensuring that disconnections don't happen for water, electricity, things like that?
Let me answer this. I want to talk just a second about the broad spectrum here of everything. And I want, first and foremost, I want to caution everyone, whether they be at the state tournament or wherever they may be extra safe in everything, getting home and doing the things you're doing, Because here's the thing, if we don't watch out, we're trying to be super proactive. We're trying to not in any way run into a crowded theater and start screaming fire and everything, and then have bad things happen and maybe we really didn't need to create the panic level that we're creating. You've got to really be cautious of what we're doing here, while at the same time being super, super vigilant and very, very, very proactive in what we're doing. We're really prepared. On a national level, and I'm sure on a state level as well. I mean, just think about this. I mean, just think for just 1 second. And I just spoke to Bernie, and here's what I said. The state tournaments are where they derive most of their funding. Well, what's going to happen if you go down to 100 people that can come to a game or don't have any state tournament, period? How is the SSAC going to function? They got a real problem. How's the person that has a utility bill that doesn't feel well and really is encouraged to stay home, and they do stay home, how are they going to pay for their utility bill? It is the exact same thing on different types of scales and whatever. Our federal government fully recognizes this, as do I within the state. Whether there be insurances that will possibly cover stuff, or states or our federal government will have to step up to be able to make people whole. I mean, to be able, if we really and truly get into that level, but we're not there right now, but if we get to that level, what will have to happen is just this. And then all your questions become semi-mute. Really and truly what will have to happen is the state and our nation will have to step up to make people whole. That's what they'll have to do. You know, at the end of the day, really and truly, we can't have a monster virus put people on our backs and run us off the financial cliff. We can't do that.
I mean, can we talk a little bit about panic? Because I feel like this is a really important point at this point in West Virginia. People are afraid. Like, you are on social media, and I see that here. And yet, you know, there's public health preparedness, but then there's also this very tangible fear that people have.
Sure, sure.
You know,
No, let me talk about it. Listen, to our people, I would say, you know, fear is not going to be constructive here. But really, just being totally aware and totally on guard and absolutely prudent in their thinking is how we need to be. You know, at the end of the day, we're blessed from God above in every way, shape, form, and fashion, and I mean that with all my heart. And some way, somehow, we'll get through this. And if we're smart and we're on our toes and we don't expose our elderly and we're prepared at our hospital level and we're prepared with all these great people in every way, shape, form, and fashion, and we do what we know is the best thing, and that is not shake hands, bump elbows, absolutely wash our hands nonstop, be just smart and not afraid. We've got to continue to live our lives. If we don't watch out, we'll get afraid, and the damage or the casualties or whatever may be greater from being afraid than just being smart.
Dr. Slim, not coming from a place of fear, but can you succinctly explain the medical and scientific advantages of a couple of scenarios? One, are we hoping that we're not going to have to close schools at all? Are we kind of rolling the dice there? Or what is the advantage if we're going to close schools in a week or two or three, if this thing continues on the path it does? What is the advantage to not closing now and flattening the possible spread immediately?
You know, I think we are making, we know that multi-layered interventions make a difference, so we're doing several things right now. These are the ones that are recommended through CDC and other settings in terms of this, where we are currently in this. And so we're looking at the ones that can make the biggest difference. And I think it's really important what the Governor Justice just said, that this is really about people getting informed. Because if you have information, you know what happens with this, you understand how to take care of yourself if you do get sick, and you understand how to prevent disease at home, et cetera, you can make a real difference. It demystifies it. So there's great information on the CDC website and our coronavirus website. There's flyers about how to prepare your household. Remember, 80% of people get through this without serious complications and not needing. They can take care of themselves at home. So this is about protecting those folks that don't. But this is about being smart as West Virginians, and we are. You get informed, and then you think about how do you do things at a distance, but you still do things. So you still need to go to the grocery store, and you do that. And if you're high risk, you might do it when it's not a really busy time at the grocery store, or you get someone else to pick it up for you. But we need to go to the grocery store. If you want to go to a restaurant and have a meal, that's fine. We're doing that with a few people at a table. And again, it's thinking about those large crowds and especially the high-risk folks. It's really about how do we practically and effectively just do that normal, good social distancing piece, and be creative about how we do things otherwise. We've got lots of ability to do things otherwise, and we're willing to do that.
I think all of us, and probably all of you guys, who regarded the calls from the and are afraid and maybe in a little bit of panic. Can we get some details, some specifics on what these plans look like? I keep saying we have a great team. I'm sure that's true, but specifics of what this plan is. Why
Yeah, and there's actually some good guidance on the CDC website around community mitigation strategies, the kind of things, what you do at what point, and we can point you to that to kind of see and understand how that works. It is a little different virus, and we're learning about it as we go. The good thing is we're a little bit behind other states in terms of the arrival and the occurrence of this, and so we have the opportunity to learn from our neighbors and see what happens in advance of too. So we're looking at that.
We're also behind on testing. Is that our numbers low?
Yeah, I think the testing is an issue nationally that we've had a challenge with. Again, we know it's around us. We know we've been testing. We also know that even with like flu, we tend to be a little bit later, typically coming in because we have a little more rural, a little more space. But I think we have to recognize, we're going to see a case. We're not going to be surprised by that. It's not going to be a dramatic risk. When we have a first case, it's not a dramatic change in that risk. It's just we've identified one. And so I think we're going to see that, and we just need to handle it as we go wisely.
Governor, you're highly discouraging large events. Can you tell me why not just ban them, or do you think there's going to be a point where you do ban them eventually?
I think the best way I could describe this, is just this, is we just had a legislative session here. We got through the session and everything. Because at that point in time, we really felt like that, we were still on the edges as far as the magnitude of the risk. The risk magnified last night. So we change and we move in a more proactive way from a preparedness to a more proactive way. Now, as we go forward, what we can do, what we should do right now is we think we're making the right measure in saying we would discourage the large groups, but we have got to move forward with what we've already outlined. Now, at some point in time, it may very well be that what we've got to do is we've got to stop school and we've got to ban the big groups and everything. But Kenny, today, we're hopeful that we're not going to have to stop school. If we knew, I'll promise you, if I knew, or any of these people knew that in 10 days from today we're going to have to stop school, well, we stop it.
We are aware that grandparents are raising many children these days.
No question. No question. Listen, we're also aware of this, that mom drops the kid off and everything, or dad drops the kid off, and they got to go to work. And there's all kinds of ramifications of everything. Today, we think we're not going to have to close schools. If that changes tomorrow, as something changed in the last 24 hours, and there's Clayton right back there, and Clayton, Clayton is our superintendent of schools in Clayton, is saying today, he doesn't recommend, nor do they recommend, closing schools because they think that we can not close schools.
So what will be that deciding factor then?
Absolutely. You know, we'll follow the leads that are coming on the national level. If all of a sudden, you know, we have another amp up level, without any question, we'll be closing schools. We'll be doing a lot of things more radical than we even are now.
The other thing to be, so the other thing to be realizing with children in schools is, and this is not downplaying this is just being, here's the science of it, but we think about this carefully. We know that people spread disease more when they're actively ill and sick. And so when we're seeing that kids don't get sick as much with this. So that's not quite the same risk as we've had in the past. Now, that does not mean that we wouldn't close a school. We will think about that when the time comes, but these were the first big measures that we thought were really important to start with.
We talked a little bit about testing.
Well, wait, let me follow up with one other comment here. You know, you could be ridiculous just to make this point. We could all go home right now and tape our windows and all go home right now. There hasn't been one case yet in the state of West Virginia. Now, if we all went home and taped our windows and stayed there, versus how it would maybe spread faster at a school or a gathering, we'd probably be better off. Today, we don't think that we should all go home based on what everybody is advising me. We think we've made the right steps, and that's all that we can do. Because if we all go home, there's going to be consequences there. Remember the old thing, with every action, there's an equal and opposite reaction. Things happen. Things just happen with our actions. And so we've got to be careful with what we do there, too.
Governor, this is a very public building on purpose, but is there any thought to limiting access to the building, or the tours that come through, or handing people wipes when they come in the door?
I've thought for a long time about not having y'all here, ever. but because y'all making it really tough on me, and I'm doing something that I don't like. Because I had a game at 7:15 tonight, and I don't like it and everything. I don't like these kids and all that kind of stuff. I don't like it in any way, you know. But I didn't get to play last night, so you know. But nevertheless, you know, Brad, we may have to do anything like that. That may very well be possible.
And I think it's.
You mentioned the tournament and your role in your role. Honestly, you fit into some of the categories that people need to watch out, your age and whatnot.
Thanks a lot.
I'm sorry. But you know, West Virginians may be concerned about our governor, because you take special precautions, rinse your hands, make sure the fist bump is still shake. Can you give us personal examples?
You know, I'm doing all that. You know, I've got so many bottles of hand cleaner around you can't imagine. But you know, we all screw up and mess up and everything. You may walk up to me and I say, Brad, how you doing? And shake your hand before I realize it. And then I'm running to a bottle of hand cleaner. But look, I'm just a little chunky and maybe a little gray-headed, but I'm in good shape. I'm ready to go.
So let's talk about testing in the world of healthcare. We've seen health insurance premiums go up. We've seen uninsured rates go up a little bit in recent years. Does poverty impact the ability of people to go and feel like they can get tested, or is there movement to offer all tests for free for this virus?
The testing through the state lab is done at no charge. And then the insurance commissioner has sent out information to all the insurers to reduce any barriers possible to that. So they are asking all insurers to make sure they're not co-pays to testing or to treatment or to other ways to deal with. They're actually expanding their ability to do telehealth and nurse call lines, those kind of things. So I think there's a lot of effort. I think the key thing is people are pulling together to each take their own role and be creative and make a difference. And I think it's important to remember that at present, The risk to most West Virginians is very low right now. And so we are just trying to be proactive and slow down and reduce that spread. We eventually will see it, and we'll see it spread, but it'll be in certain communities more than others. And so you may see different interventions in different communities. We'll be doing the same things other states are doing. But again, right now, the risk to the average West Virginian is still low. We don't have evidence of widespread transmission in the state.
For uninsured people, though, I mean, the CDC protocols are before going to the doctor, call your healthcare provider. If you're uninsured and you don't have a healthcare provider, I mean, what do you do?
We have a good extensive network of primary care centers, the FQHCs in our state. They all work on sliding scales and the ability to treat anyone. And so this is healthcare is we've got better access than we used to. We have lots of FQHCs. We dropped our uninsured rates several years ago dramatically with the expansion of Medicaid. So I think there's, this is not a different situation that we have every day with health. But it is a time for everybody to really do the best they can to help everybody move through that and get care.
Governor, can you address, while it's scientifically absolutely true that most West Virginians are not at high risk, 85% of CDCs of people will experience no to mild symptoms of this. But on the same page, when you talk about that, we're also doing unprecedented measures where we're shutting down tournaments in the middle of a tournament. We're closing. Can you see how that's a two-pronged message? And that people might, while calming on the one hand, we're doing these drastic measures on the other.
Yeah. We're really following suit with what everyone else is doing. That's why I said this has really changed in the last 24 hours. And you'll have briefings nonstop from either me or my people as we go forward. All I would say is just this. This is a virus that should be taken very seriously. It is something that definitely exposes or preys on the elderly. Without any question, you can have it and not even know it if you're younger especially, and transmit it. Without any question, right as we speak, our state does not have one case. So to run to the halls and absolutely panic and start sealing your windows up and batten down the hatches in every way, we've got to live. We have to live, and I would say first and foremost, you have to entrust that our medical professionals, our school professionals, our athletic professionals, they're not asleep at the switch and they're working. As things progress in a positive way, we'll have to take even bigger steps. If things progress in a negative way, then what we've done is maybe we've taken a more aggressive, proactive stance that maybe we could have gotten by with, but we can't risk it. We cannot risk it with all the stuff that's going on. And so with all that being said, I think we're done. We'll come back. We can answer questions till the cows come home. You know everything now as best you possibly can, and we'll keep you updated every day. Thank y'all so much.
We can expect these every day.
We'll have a presser every day.
Every day?
Every day.
Okay.
Every day. Okay? Thank y'all.